Thank you. Good afternoon. Everybody's good? Got your pizza, your salad, get the healthy part too, right? So thank you for having me. So let me just jump right in. When I was preparing for this lecture today, of course I was thinking about the topic, the title of my presentation, but I also began to really reflect on this idea of health, racism, and communication, that this is a series. So I thought that I would really just start there, and we're going to talk a little bit about, this is about communication. This is a small group. So while we will have a Q&A session at the end, certainly feel free to, if you have a question, to jump in, ask a question if you need to. But communication is really a way that we communicate ideas, that we talk and share with one another, different concepts, different plans, different strategies. So if you have something that you want to add to this conversation, definitely feel free to jump in. So what are we going to be communicating about today? We're going to talk about ways that racism has contributed to perinatal disparities. We'll discuss some strategies for improving birth experiences and eliminating perinatal disparities, and describe approaches of community engagement in addressing those disparities, particularly in the context of the work that I do with my company, Sister Midwife Productions. So then, the next piece is communication, racism, right? The fabric of racism is inextricably woven and constructed into the founding principles of the United States. That was said by the People's Institute on their website. Everybody know the People's Institute for, what is it, for something and beyond, right? For survival and beyond, thank you. And they are doing some great work around undoing racism. Regardless of their work, though, racism persists. It is real. It is happening in this country all the time, unfortunately. The thing that's important to know about racism, and we have to make sure that we're all on the same page with this, is that race is a social construct. It is not a biological thing. It is not a physiological thing. It is purely a social construct, intentionally designed. Intentionally designed. One of our great thinkers says that true racism, Claude Anderson said this, true racism exists when one group holds a disproportionate share of wealth and power over another and then uses those resources to marginalize another group. So what we know is that the way that plays itself out, not just in the United States but worldwide, is we have white people practicing racism across communities of color, particularly against black and brown people. And this is not just in the United States of America. This is all over the world. So then the last component of this series is health. The World Health Organization says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now, there's been a little, first of all, they decided on this definition from the beginning, right? Late 1940s, they put this into place, and they haven't changed it. This is their definition of health. But there are some people who think that it's a little too much and it's a little hard to kind of deal with, and everybody cannot use this definition, and that we should also add the ability to adapt and manage physical, mental, and social challenges throughout life. So for me, when I think about this addition or the need or the desire for someone to say that we should be able to adapt to social conditions, what you're saying to me in the context of racism is that in spite of social injustices that are happening, and in spite of the fact that these things are directly impacting my health and well-being, that I should just figure it out, get over it, get along. So I reject this notion that we need to add the ability to adapt. Obviously, being a black woman in America, I have learned to do some adaptation. But the adaptation really is the thing that's making us sick and ill. Because whenever there is racism, there can be no health, period. That's what I think. Y'all could put my name on that. Sister Midwife said that, right? Wherever there is racism, there can be no help. How many of you have heard of the weathering principle? Excellent. If you don't know it, you didn't put your hand up, make sure you look it up. The weathering principle tells us that our allostatic load is elevated. Our ability, our bodies have an innate, wonderful ability to balance itself out from stressful situations. We have fight or flight. We see a dangerous situation. Our bodies will get it together to deal with that scenario. But when you are constantly living underneath those types of oppression on a daily basis, whether it's small microaggressions or huge issues, over and over throughout your life, the allostatic load goes up and we see many, many chronic diseases. So much so that we began to, at some point in history, think that things like high blood pressure were hereditary and only hereditary, but they're not. They are a condition of the society and we live in. Yes, sometimes it's a condition of lifestyle choices and that sort of thing, but in addition to that, there is absolutely a connection between our allostatic load, the lives that we live as Black people in America, racism, institutional, systematic situations that impact how we're able to care for ourselves. Now, historically, inside of the healthcare system, there was a lot of racism that's happened. Anybody recognize this picture? If you don't know who this is, you need to write this down. J. Marion Sims, a monster, an obstetrician who is still, unfortunately, looked upon as the man, what do they call him, the father of gynecology. They still, to this day, have statues erected in his honor, and they call him the father of gynecology. Why? Because on the backs of Black women who were enslaved, he perfected various surgeries and instrumentation using their bodies without any sort of anesthesia. He is one of the main reasons why even today, in medical schools and in physician offices across the country, people believe that Black people don't feel the same amount of pain as other people, which is completely ridiculous, but he started this. He helped to make that a norm and a thought process, and it has stayed with us. We have things like the Tuskegee experiment, killing the Black body. Against their will, North Carolina sterilization program where they sterilized so many women against their will. And this is all across the country. Mississippi had, they would call it the Mississippi appendectomy, right? Because so many women would go into the hospital to have their babies and come out sterile, come back with no uterus. And then, of course, we have the wonderful book, Medical Apartheid. And when is Miss Washington coming to speak? Next week? Next Monday? If you do not know this book and her work, to understand about racism and health disparities and the impact of how racism has shifted how people think about taking care of people of color, you definitely want to make sure that you show up to hear what this phenomenal author has to say. Medical Apartheid is like a Bible, as well as Killing the Black Body for me in terms of reproductive justice and the work that I do. These two books, if you are in public health and you want to work with communities of color and you want to work particularly in reproductive justice work, you absolutely, not that everybody in here does that, but if you want to do that kind of work, you definitely want to make sure that you have access to both of these books. Now, the interesting thing is this is historical context, and all of these things are historical, but we know that these things continue. So this was an article that was posted about the California, they had to put a ban in place to stop the prisons in California from sterilizing inmates. This wasn't a long time ago. This article was written in 2014, and as recently as 2010, they were sterilizing inmates without their permission. So the reason I'm bringing all of these things up is to let you know that the context of health in this country has always used Black and brown bodies as teaching fodder. It continues to do that today. I don't know if you all saw the USA Today article about the birth outcomes at Touro Hospital. It was a really horrible article for Touro, but it tells some very telling stories about the kind of things that are happening at Touro Hospital, and they blame some of it on the residency program. I can't say if all of that is true, but I do know that still today we are using Black and brown bodies, low-income people, people who are marginalized, to do research and to learn our medical care. I was a nurse midwife student, right? I worked in a teaching facility. All of my patients, for the most part, at Grady Hospital in Atlanta, they were Medicaid moms. They were non-English speaking moms. They were Black moms. But because of who I am and my experiences, I know that I gave those women a different kind of treatment and respect than many of my other colleagues. So we have to understand this historical context because it's not just history. Unfortunately, it's still happening today. So I already mentioned this, that race is a social construct. And this is important to know because race does impact our outcomes, but we want to emphasize that my race does not make me high risk. And that's the story that they tell, right? So just because I'm Black, in and of itself, born Black, in and of itself, does not make me high risk. What makes things high risk is the fact that the outside systems, the systematic way that we are treated inside of institutions, whether it's Tulane University or Tulane Hospital, that impacts the outcomes. And indeed, it does impact the outcomes. This is data from 2015 for Louisiana. We can simply look, I'm sure many of you already know this kind of stuff, but we look at the disparities between non-Hispanic black women and non-Hispanic white women. We see 19 to 12, really almost 20% to almost 13% in terms of preterm birth. We see low birth rate, infant mortality. And then when we look at the most recent statistics for maternal mortality, 4 black women in Louisiana die for every 1 white woman. This is a national statistic, and in some communities it's even worse, but this is the statistic that's here in Louisiana right now. Regardless of education, these things continue to persist. Regardless of socioeconomic status, the perinatal disparities persist, and this is critical. Because there are a lot of people, a lot of your colleagues even, and people who you know, they don't want to believe this part. Oh no, it's just because they don't get prenatal care, or they're not educated, or it's because they don't have access to things. The statistics show us that a black woman with a graduate level degree, I'm talking doctors, lawyers, social workers, still have worse perinatal outcomes than white women who didn't even graduate high school. So they're high socioeconomic, they're highly educated, and they have access. They're insured, but yet and still, they still have perinatal disparities that are worse than white women who did not even graduate. In fact, I looked at some statistics this morning, less than white women who didn't even finish 8th grade. I'm like, wow, that blew my mind. I just want y'all to know that. So for me, as a black woman, as a friend, as a sister, as a nurse, as a midwife, knowing these things, I began to just get frustrated. And I began to I asked myself, what can I do differently? What can I add to the conversation? What can I bring into my community, into the community at large, to really discuss this issue, and how can we shift some of the conversations to change outcomes? I'm about making stuff happen. I'm not just about showing statistics, because at this point, I've been talking about these statistics for years, for decades. In fact, I remember when I was in undergraduate school, if anyone graduate school, have you all seen Unnatural Causes? If you haven't seen Unnatural Causes, make sure you see that. It is a docuseries. It's about 5 parts, I want to say. The second part is about perinatal disparities. But the question that this documentary asks is, are inequalities making us sick? So it talks about everything from high blood pressure, heart disease, cancer, but there is an episode specifically about perinatal disparities. Obviously, that's the one that I connect to most. One of the professors in the documentary was a professor of mine at Emory University. And I remember being in her class. I was a public health major, and I did health policy and management, but she was over the maternal child health department. So I took her class, and I did a paper on the impact of racism and low birth weight at that time. It was not new information, but people weren't talking about it. So this was like in 1998 when I did this paper. You understand? I remember being in Iowa. I was in Iowa as a travel nurse at a little bitty hospital in January in the middle of a snowstorm. So all I did was sit in my house when I didn't have to work and sit in the hospital when I did. And the hospital was so tiny that I would go to work very often and not have anything to do except twiddle my thumbs. So I started blogging, okay? And I remember one night doing research. This was in 2007. I remember one night doing some research about maternal mortality. And I found myself at work in the middle of the night bawling, because I looked at the numbers and I was like, why isn't anybody talking about this? At that time, my business hadn't been born. I was in Iowa. I was on my way to come back home to New Orleans, and I didn't know exactly why I was blogging, so I blogged about this. And at that time, I didn't have a business. I didn't have a brand. So maybe 20 people saw this blog post, but I remember being like shouting from the rooftops, hey, y'all, this is significant. But it still wasn't a big conversation at the time, so I just kind of let it slide. About a year later, from that blog post, Hillary Clinton spoke at a worldwide women's summit. And she was talking about healthcare disparities and maternal mortality and different things. And she talked about that every woman should have equal access to this and that and quality care and what have you. Again, I do a blog post. Ain't I a woman, I said, right? Do black women matter in this country? Again, crickets. And I was like, wow, nobody cares about this thing. So again, I just left it alone. Now, everybody's talking about it and everybody cares. Almost, this might sound odd, almost to a fault. Because the way women are being notified now about maternal mortality, the only thing that's happening right now is you are scaring women. So now I'm getting emails. I'm getting comments on my blog or on my Instagram posts. I'm getting comments on my Facebook posts. Help me. I'm scared. I'm 4 months pregnant. What do I do? My wife is pregnant. We are scared. How can you help us? To me, that is not helping the problem. Anyway, so I digress. All of these things in my head, when I got home back to New Orleans, I decided that I was going to do something different, and I started my company, System Midwife Productions. And I really decided that I was going to use my company, my expertise, and the information that I had gathered from working in hospitals all over the country to empower families and individuals to understand how to advocate for themselves. See, I've worked when I tell you I've worked all over the country, New Hampshire to California. I worked as a labor and delivery nurse in many facilities, but I also worked as a clinical educator. So if you've had a baby or you've seen babies being born, you know the fetal monitor that they attach to the mom's belly. I worked for one of the companies that makes those monitors. And I would sometimes be in 3 and 4 hospitals in 1 week. And I would train the nurses on how to use their new equipment. And in the midst of that job, it was so clear to me that this thing of treating women poorly was happening everywhere. Because, see, I would be in the conference room taking, 4 or 5 nurses at a time to come do the training, and in the meantime, I could hear what was happening in the hallway. And if I wasn't that busy and nobody was coming to training, for me just to kind of gather what was happening so I could say what I'm saying right now and know that it's true, I would just walk down the halls. And I would hear the conversations, and I would look at the board with breaking all kind of HIPAA violations, and I would have conversations with the nurses who were open to midwifery and to natural birth, and they would tell me secrets because nobody else would listen to them, and I was an outsider, and so they had nothing to lose, so they would share secrets with me. So when I tell you that I know that they are treating women badly nationwide in having babies, it's because I've seen it and I've been there, and this is real talk. And I'm talking, I did that job for 2 years. And I was literally sometimes in 3 and 4 hospitals in 1 week. I've been in the hospital that had the #1, like the most babies in the country. I've worked in that hospital. I've worked in hospitals with 4 babies a month. And it doesn't matter where I was. These things continue to persist. So I started my business because I felt like we needed some new answers and a new way to talk about this issue. I decided that I didn't want to start a nonprofit because I didn't want to do what I call the grant game, grant chasing. I had been around nonprofits before. I had worked in that industry as well. And I thought, I don't want anybody managing my brand, telling me what I can and cannot say, telling me how I have to educate people. Oh, no, you can't talk about condoms, but you can talk about this. Or, oh, no, you can't mention that, and you can do this. I didn't want that. I wanted to have full control over the messaging that I was bringing into my community and to every community. And so I decided instead to start an LLC. And I thought that I liked the concept of social entrepreneurship, whatever that meant. I looked it up. That sounds good. That sounds like me, right? So what is a social entrepreneur? Someone who's bringing radically new solutions with the potential to revolutionize an entire area. And that's what I feel like I do, right? I believe that birth is the revolution. And if we revolt, that is to rise up against the status quo and shift the way we think about mothers and babies and pregnancies and families, we can elevate the vibration of our communities. #birth is the revolution. One of my missions is to increase the numbers of black and brown birth workers and also to increase the numbers of non-black and brown birth workers who understand what this is about, who get it, who can come into my trainings, into my classes and hear the truth, who are not afraid. So my classes are not just for black women. I have all women come to my class. My classes are definitely geared with the black woman's experience in mind. Everything that I talk about, it is centered in black women's experiences. It is centered in racism. It is centered in understanding holistic care around pregnancy and birth. It is a 40-hour training, more than most doula trainings that are out there, because I believe that we have to do this thing way bigger than we've been doing. It is not just for black women, but I understand that when black women who are pregnant have black providers, we can change disparities. We know it. The research shows us that. So what else did I do in my social entrepreneur self? I created the most comprehensive black midwives and doulas directory online right now. Right now we have about 500 people listed on our directory. Why did I do this? Because in 2012, when my business was brand new, on Facebook, on Twitter, we would see messages. Anybody know a black midwife in Dallas? Anybody know a black doula in New York? And I was like, it's 2012. We don't have a directory. So painstakingly, my first directory, one name at a time, I initially reached out to people that I knew personally, about 50 different midwives and doulas, and I said, please help me, this is what I want to do. They submitted their information, and literally one person at a time, I hand did all of the information. But I knew that I couldn't continue doing that, so last year I was fortunate to find a platform that allowed me to create a much more robust directory. It is so phenomenal and beautiful, and it allows women all over the country to find the black providers that they're looking for, and it also allows other people, so you need a speaker to come in and talk about these issues. You have a young woman in your practice that you think would benefit from having a black doula or midwife, you can come to this directory. You can network with people from this directory. And it is changing lives because black women want black providers. Now, I tell women all the time, if you can't get a black midwife, that's okay, get a white midwife. Just get a midwife, right? If you can't get a black doula, get a white doula. Get a doula. Right? But if you really would like to have a black doula, here is your resource. And so again, in my social entrepreneurship, I found a small way to monetize the directory. It is free though. So if you're a provider, you can get listed for free. But if you want to add your picture and be real cute, right? You pay a tiny bit. I became an evidence-based birth instructor, because part of my other mission, in addition to increasing the numbers of black and brown birth workers, is to, like I talked about earlier, it's like to blow the lid off this prenatal education thing and to really bring some different information. If you are interested in birth work, Evidence-Based Birth is a wonderful, wonderful website. Rebecca Decker has done a great job. She's a nurse PhD person, and she does it. She does the research. That's what I thought I was going to do when I first started blogging. I thought I was going to do this. I don't have time. It's a lot of reading and statistics and big books and stuff. Rebecca does that very, very well. So I became an evidence-based birth instructor, which allows me to bring real-time, phenomenal training information to the community, and it also allows me to generate income because people can get CEUs, continuing education credits, whether they're doulas or nurses or even midwives, for attending the training. So those are some of the things that I created in terms of this entrepreneur piece. The next thing was, how do I engage communities? How do I bring them into the fold to hear what I have to say? Infant and maternal mortality, who wants to talk about that? Preterm birth, babies dying, birth trauma, mamas dying. Don't nobody want to talk about that? That's not fun. That's not interesting. So how can I engage communities in a new and different way? So one of the things that I created was something called the Art of Birthing. Last year was my third year doing it, and basically it's a series of events using artistic expression to discuss birth outcomes and pregnancy and that sort of thing. We use art, we use music, we use poetry, and we have a good time. And in the midst of it, I have really been amazed at the people who have come up to me, particularly when the young men come up to me like secretly, this changed my life today. Really? Because maybe they came to the paint and sip. And after the paint and sip, or in the middle of the paint and sip while we got music going on, I get on the mic and I make an announcement. Or maybe they came to our Giving Voice to Birth open mic extravaganza. If y'all know Mwende and Sunny, right, those two sisters are so powerful. And last year when Sunny got on stage, man, she took it over, right? And Sunny understands birth is the revolution. So when she gets the mic, she does my job for me even better than I can do it in terms of the poetry, right? So then we have people coming to an event like this to have a good time, drink a little wine, have some open mic, but also they leave there with a new awareness and understanding about what we're dealing with in our community. One of the most touching things last year at the open mic, there was this young man, maybe about 27 years old. That's young to me now. Oh, Lord, I'm getting old, y'all. He did a poem, and it was about his mother dying in childbirth. And after he did it, I was shaken. And I was like, was this a true story? Oh, no. I wrote it just for tonight. Whew. Okay, because I was so moved. But this young man heard about this event, did research to understand maternal mortality, to present a piece. I guarantee you, he's telling his people about this information now. You understand? So it's a new and different way that I thought about how can we engage communities a little bit differently. Birth Justice Film Festival, always the most successful, one of the most successful events. We showed a number of films. We have panel discussions. Families come, pregnant women come, grandmothers come. People come, and they listen, and they get information. They ask questions. Every year I've had pregnant couples come to hear about alternative health, to hear about midwives and doulas. See, it doesn't have to be childbirth education. It doesn't have to be all doom and gloom. We can celebrate these things and offer options and information without doing it that way. So now I've been doing this, I'm on 6 years, I think, since I created my business. And I'm not really, I guess I am an entrepreneur, right? But that's not what I went to school for. So there's a learning curve. And there's different ways that you have to try to learn how to do things so you can do what you need to do. I was blessed a couple of years ago to get involved with Propeller. And one of the things that they did for me, everybody, y'all know what Propeller is, like a social venture assistance thing, right? And I had been in business already for 5 years, and one of the things that they helped remind me is that there is no social entrepreneurship without the entrepreneurship. So I began to really think way more seriously about how can I generate the income that I need to be able to do. See, because I'm going to do this work regardless of the money, right? There are programs that start and they stop because the grant funding ended. There are organizations that start and stop because the grant funding ends. That's not going to be me. So I want to have great sustainability. So one of the things that I do is I have a t-shirt line, right? This is one of them. Don't ask me to buy one right now because I don't have good business stuff right now, so I'm working on it, right? But I sell them mostly in my doula trainings, but I am moving now. My business is growing. I have a real admin assist now who works every week. I have some phenomenal volunteers and interns who are with me now. And so we're going to get to the point. I have 5 designs. Those are, 4, right? 1, 2, 3. I feel like, I have 5 designs. I have another shirt that says, birth something beautiful, right? That was my first hashtag. So this is the one right here, though. This is like everything. This is going to be the one that's going to, like, take off. But all of my T-shirts, I sell my shirts. I also have created my online learning center. It will be launching fully this spring, where I'll be able to offer courses, some of them free, some of them for sale. They'll be for parents. They'll be for people who want to do birth work. There are so many people who take doula trainings, who then email me. Now, y'all watch how this goes. I get an email. Greetings. I would love to have a conversation with you. I took a doula training with somebody else, and now I need help. So, well, who trained you? Because they should be, I help anybody you train with me, you got me 100%, 24/7. You can text me, call me. I might not always get back to you immediately, but I will get back in touch with you because now you are a part of my family. And I appreciate that you appreciate what I do, right? So whoever trained you, they didn't do a good job, but soon I'll be able to say, well, I got this course for you. It's $29.95, and it's going to tell you everything you need to do to get started with your doula business. You understand? Because people are not getting that guidance. And then what this helps me do is to keep doing my work. So this is the current project that I'm excited about. I do sometimes, now I don't chase grants, and I don't play the grant game, but I do sometimes, like right now I have 2 small seed grants that I'm working with. So one of them is allowing me to do something called the Birth Story Project, but rest assured when our grant funding ends, we're not stopping this because that's not how I roll. So once a month, we bring Black women together. It's the Birth Story Project is designed to bring Black women together to tell their birth stories, to tell their truth, to talk about their experiences, good, bad, or indifferent, home birth, hospital birth, C-section, miscarriage, parenting, breastfeeding, all of those things. An opportunity to come to a safe place to complain, to celebrate, to be loved. And every month, whether we have 3 people or 10 people, women are moved. I can't stop this because I don't have grant funding. It don't even cost us no money. We have refreshments, we pay $50. I got $50. You understand what I'm telling you? And if I sell a few more webinars, I'll have even more, you understand? So that's my vision. That's where I want to go. I want to be my own grant funding source. I want to always be able to look at myself and say, what can I do? What can I share? How can I make this better? And if a little bit of grant money comes along and I get a fiscal agent, and that's cool, but that's not going to be my focus. Right now, I'm also working on a great project I got a small seed money from Blue Cross. So we are working on creating a statewide educational program to train perinatal community workers. Now, we're in the very beginning research stages of this thing, but it's going to be a beautiful, beautiful project. And I have faith and vision and belief that it's going to change what we can see and do in our state. And the way I keep talking about it, I'm like, we're number, I think 2 or 3 for maternal mortality. We're like number 5 or something like that for infant mortality. There's no place to go but up. Our outcomes are so poor. Even if the program I create is crappy, there's no place to go but up. And I know I'm going to create a good program, right? So it's going to be phenomenal. That said, I want to end with some words from, you think it's going to work? Do we have internet connection? Oh, yes, there it is. What's some words? So we record all of our sessions, but we don't video them all. This is the first little pilot session that we did, that we videoed. We're going to do our second video session on the 26th. I'm working in connection with another young woman named Delise, who has the company High Heel Productions. And she is a perfect example. So this young woman had a home birth. First, she was pregnant. Delise, can I tell you a story a little bit? She was pregnant, she was going to the hospital and asking questions, advocating for herself, and getting pushback. Nope, you can't do it this way. Nope, you can't do it that way. Nope, we don't want you to do it this way, so on and so forth. So she was like, forget all of that. And she ended up having a beautiful, life-changing, transformational home birth. After her home birth, she came to me, she said, Mama Nicole, people got to know about this thing. It's so much I didn't know and so much that I didn't realize I could share, and now I want people to know. And she went to school for videography and film and all of that, so she created my logo. So she said, I want to do a docu-series. I said, okay, I actually want to do a birth story circle. Let's get together, right? So we're going to film some. The ones that we film is invitation only, like we let people know that we're filming, right? And they come. But then the ones that are every month, they're not being filmed. They are being audio recorded because the full vision is that we will take the quotes and we will have a meeting with the midwives at Ochsner. And we'll say, I get that you're doing great work, but here's what 20 women said about you. And it wasn't good. So that's the big plan, right? That's where we're moving to. And so we got to get a lot more. I can't stop. I got so many stories to collect, right? So let's see if that's going to work. Nope, that's not how it works. Let me go to the computer. This is from our first video session. Will we be able to hear it? It does now. Anybody IT in here? I asked him not. I said, don't leave me. The IT guy. Yeah. Seems like all of the things are on. Okay, so in the meantime, I will stop while we get this together, and because that was the last piece. I can read their lips. I've seen it so many times. She's like, my first birth was. No, you're not moving. Anyway, questions. Anyone? Comments, thoughts, questions. I'm done, y'all. You know, okay. Yes.
Is there a minimum age limit for your training? My daughter would like to sign up.
I had a young woman in my Memphis class who was 16. I loved it, and she was so everything. I was like, girl, and she knows she wants to be a midwife. It was beautiful. Yes, so no, but I do have conversations with the parent first, so that you can know this is what happens in my class. I want you to know before you approve. You know what I mean? Yes. But yes, just reach out to us, and we can have a conversation. I can make sure that you are comfortable with everything.
Simply the experience.
All right.
Oh, backwards.
That's okay. Thank you. All right, let's do this.
Simply the experience of living in America as a black woman does something to your body that causes low birth weight babies, that causes maternal mortality, that causes infant mortality. Second is that there is a kind of racism in the healthcare system.
So my first child was an emergency C-section. And so I got induced with Cervidil, and then next I got Pitocin. And soon after that, I got an epidural, and after that, her heart rate just dropped. And so it was a very traumatic experience for me, because it was polar opposite of how I envisioned my birth.
I don't think I was fully aware or prepared for the kind of emotional journey I would go on through pregnancy.
So I went in, I was like, I'm not doing this. You're not doing cervical checks, you're not doing this. And they were like, oh, okay. You seem really educated. Like it was like cool, but they also made me feel like, oh, we're surprised you know as much as you know, type of thing.
And your blood pressure was a little high. It's because I'm in this hospital and y'all stressing me out.
Ask a question about every single thing. And just because it's routine doesn't mean it's necessary.
I know that this particular hospital midwife has done this to other women. So it just made me like feel sorry and hurt for those women who had to go through that too.
She's an OB, and I don't think she's ever seen a normal birth.
I remember she asked me, my hospital midwife was like, oh, is this your baby daddy? And I was just like,
Baby daddy.
yes.
Like hospital midwives and OBGYNs, not, at least my experience has been in my 3 pregnancies and, 3 births, is them not being like culturally sensitive.
My OB is black, and her nursing staff is all black. And so they would always call him my husband. The nurses, the black nurses, because as black women, they knew that would be insulting to me to call him anything other than my husband.
A woman should not go into a hospital and have to birth like that. My name is Brittany, and my birth story was magical.
My name is Aishaba, aka Regina, and my births were uniquely and divinely aligned for my spiritual growth and development.
My name is Shay Pounds, and my birth was transformative.
My name is Kristen, and my birth was perfect.
My name is Isis, and my birth was healing.
So this is just like our trailer pilot video. We're gonna Delise has organized where she has oh wow, look at this. And then what is this? Let's say where she has it's really interesting. This is not my YouTube channel. Where she has topics, 12 different topics. And so right now when we do the circles, we just kind of let it be free flow, right? But we're gonna also do specific, we're gonna do one with fathers, and we wanna do one that's just about C-section and just about home birth and just about prenatal care and so on and so forth. So look for the flyers. Right now it's the 4th Saturday of every month at the Tumbar Life Center on Claiborne Avenue. I don't know the address off the top of my head, but it's easy to find, Tombar, Tombar, and tell women to come. It is a black women's space only. And yeah, so that's that. Yeah. And I'm so excited about it because it's been so simple. And at every single circle, like, everybody is like, oh my God, this was everything. At our last circle, we had a mother and a daughter. So it's really interesting because there was this comparison of what the mother experienced 30 years ago in California and what the daughter experienced 10 years ago in Baton Rouge. And so that conversation and the juxtaposition of those two experiences was also very interesting. So and it's like we're starting like a little support circle. So some of the postpartum moms, they come. It's like, I put my baby, daddy got the baby. This is like their time to come and decompress and be away from the baby. And so it's been great. Yeah. So I didn't plan a long talk because they told me give 40 minutes because y'all were going to ask me questions. And we're going to have a conversation, remember? So thoughts? Thank you. 1683 North Claiborne. Tombar Life Center. Yeah. So the next one is Saturday.
So first I want to say thank you.
Thank you.
And we do have time for questions, so please.
Yes.
Thanks, Nicole. That was great inspiring talk. I'm thinking a lot about the USA Today article that was horrific. Everyone should read it today. Talking about severe maternal morbidity and maternal mortality in New Orleans and the care that black women are receiving in hospitals. And I know, like, as a lot of black maternal health advocates, myself and researchers, and as a social epidemiologist, our work is focused on sort of getting, the general public, but also healthcare providers on board with this idea of context being really important, structural racism, weathering, all of the things that make black women have higher rates than white women. And a lot of it that happens just because you're being involved in America, so before you even come to the hospital. So how do we get providers on board with that idea, but at the same time not allow them to use that as a reason to sort of excuse their own responsibility in these cases?
So I think that's going to be different for every provider. One of my big dreams, and don't tell anybody, but one of my big dreams is to call a meeting of all of the black female OBGYNs in the city, like a dinner. Y'all know, come eat. I got food and wine for y'all. Let's have a conversation, because their response should be a little different from the responses of white male physicians, as an example, right? Like I would kind of hope that they would have a different perspective on this topic. So I think that it's going to be different for everybody, and there will be some people, so those of you who don't know about the USA Today article, it came out the Thursday after Mardi Gras, and I thought to myself, if they had put that article out on Tuesday, it would have been so very different, because it came out and I got an email about it immediately. Like, hey guys, look at this email. Look at this article, and I saw it that Thursday morning. If it had come out on Tuesday, we still might not have seen it till Thursday. But it gave people an opportunity to process it and to respond. So the response from Turo, and basically it was an article that chronicled either 4 or 5 cases, I can't seem to remember, and it was severe morbidity and mortality, a woman who was amputated because of gangrene, a woman who had a total hysterectomy, there were 2 maternal deaths that were chronicled in the story, and all of this in very recent time at Turo Hospital. So it really blasted Turo Hospital. It was not only about Turo. It was about the 120 hospitals nationwide that have the worst perinatal outcomes when compared to other hospitals. It was very sensationalized. It didn't offer any solutions. It was very unbalanced. So it was problematic in a lot of ways, and it also was giving facts. These were real stories of real people that had delivered at Turo. So the response immediately, obviously, from people was knee-jerk. It's not our fault. They didn't compare apples to oranges. Our patients are more high risk. But the article actually talked about that they compared a high-risk hospital to a high-risk hospital. So it's going to be a real sensitive, it has to be so sensitive. And when we talk about racism and social constructs in general, it has to be such a sensitive conversation because people are just not ready for it. I, as a part of the Louisiana Parent Equality Collaborative, which is It's a national project, technically, where every state has the opportunity to participate in bringing hospitals together to effectively work on specific outcomes and change. So for Louisiana, the women who die in Louisiana, still the two #1 reasons for death are cardiovascular disease and hypertension kind of stuff and hemorrhage. So what we're working on from a clinical perspective is helping hospitals see how they can evaluate and change practice around managing hypertension and hemorrhage, right? But as a part of this, we also want to bring in the social context of racism. So I was, unfortunately, but fortunately, out of the country when we had our January meeting. But what I heard was that in the midst of the racism conversation, there were some people who walked out because I'm not hearing this, I don't want it, you know, kind of thing. And these are people who are a part of this collaborative to make statewide change. And so I just think we have to figure it out, one person, one doctor at a time. And it's not going to be easy. There's no one, and that's the whole thing. Like, there's no one answer. There are so many pieces to this puzzle. And I just look at how we do a lot of non-evidence-based practicing in terms of obstetrical care. We still do too many inductions. We don't let mothers have vaginal births after cesarean section. We don't let women walk and eat and do what, you know, like all of these different things. We have a very boxed way of treating women. We don't say, oh, this woman is healthy. And so therefore, we can treat her differently from the woman who's unhealthy. We put them all in the same basket. So there's a lot of change that has to happen. Yeah.
A lot of women's health insurance dictates who they can see or where they can go. So, like, in the context of health insurance, like, how do you deal with that kind of restriction with providers and care systems?
Just part of the system. We have to begin changing it. And it impacts a lot of stuff, particularly like with Medicaid, right? And contrary to popular belief, Medicaid is not for people with low socioeconomic status, right? There are income restrictions on Medicaid, but there are full-time working people who are on Medicaid, particularly for pregnancy, because their regular insurance is lacking or doesn't have maternity care, and so there are a lot of people who receive Medicaid, and there are a lot of physicians who don't accept Medicaid, and they're not required to accept Medicaid. Or your Medicaid takes 2 months for it to come in, and nobody will see you before the Medicaid. So some of that is like legislation change. Some of it is also community education, because I tell everybody, like, I don't care what you want to do, as soon as you know you're pregnant, apply for Medicaid. If you get denied, you get denied. But if you get accepted, you get accepted. The quicker you go online, it's like 10 minutes. It's not, I mean, maybe it's 20. I don't know, but like, it's quick. Go online, fill out the application, and just do it. And then if you don't even want to use it, you don't have to, but get it so that you have it. Maternity care insurance is so expensive. If you have private insurance and you want a maternity rider, it can cost you an extra $200 a month or something ridiculous. I also think it's important to educate people about, so there are a lot of women, for an example, who would consider home birth and they want a home birth. But in their mind, home birth is inaccessible because financially they can't afford it. But their private insurance has a $25 deductible, or a copay at every prenatal visit, and they have a $2,000 deductible. So by the end of their pregnancy, they came out of pocket with $3,500, and guess what? You could have had a home birth. So we also have to just educate with those kind of things. I know it's not fully the answer to, you know what I mean, but there are other ways. Doulas are not currently covered by any type of insurance in Louisiana. It's Oregon. New York just started a program, but that's something that we're getting ready to work on and try to advocate for. The big issue with that, though, becomes how much does the government think doulas are worth? So in state of Oregon, they reimburse about $350, which is nothing. In New York, I think it's similar. It's going to be similar. So the conversation is that minimally, doulas should be reimbursed about $1,000 per client. And while that, for some people, sounds like a lot, most doulas, particularly when we're doing social justice type doulaing, you are doing a lot of work. You're showing up. You're doing 4 or 5 prenatal visits, 4 or 5 postpartum visits, and you're also there for 24 hours in labor, 10, 12 hours in labor. It's a lot of work, and you should be able to receive a livable wage. I read recently that the technical livable wage in Louisiana is, or maybe it's New Orleans, is $12 an hour. Yeah. Not good. And so they don't even get that though, you know? So we have to advocate for it. And there's a lot of places on the national level as well as on the state level where it's happening, where people are, so we just have to look at the models that are working. I'm really curious to see what's gonna happen in New York, because they just instituted this new pilot program where they're reimbursing doulas, and they have this whole thing going on. It started right now. So I think people are watching to see how that's gonna happen and how it's gonna pan out. Yes. Wow, that's nice.
My OBGYN, who was very progressive because I hunt her down to do a piggyback for my second child, she told me about it once I talked to her about some of my,
Desires, yeah.
And so I had a doula free of charge in Minnesota, and that child was almost 14 now, but I believe that program is still in place.
Yeah, so Minnesota apparently has a lot of stuff. I was in a meeting yesterday with having a conversation about creating a prison doula project, and the person who has like the national model is from Minnesota. She was here to talk about that. So Minnesota got some stuff going on. Yeah, that's cool. It's really having people understand the value of it. And that's part of my paradigm shifting too. I tell people at your baby shower, first of all, you don't need a baby shower, but that's a whole nother conversation. But when you do have your baby shower, have like a bucket, right, that says doula fund. And have folks don't buy any more onesies. You don't need them. You don't need the changing table. You don't need all of that stuff. And I talk about this at my events too. Like, we have to really begin to prioritize the experience of that birth and not the stuff. And I remember when I had my daughter, I was overwhelmed with the stuff. I was like, I already knew I was gonna home birth, which I didn't, but that's a whole other story. But I'm gonna home birth, and I know I'm gonna breastfeed, and I know, so I didn't have to do any of that research. So all I had to research was stuff. What kind of crib and what kind of car seat? So overwhelming for me. And I thought, my God, how can people, that's why they don't think about doulas and midwives and all of that stuff, because they got to get a crib and a car seat and the pack and play, and all of those things begin to take priority. And so then you forget and you don't make time to research doulas and research home birth and research midwives and all of that stuff, because you're getting stuff. So I tell people, forget about the stuff. Your baby they don't know, they don't need it. I promise you they don't need it. My baby didn't have it. She didn't need it. And if anybody know my baby, y'all can rest assured you don't need it. Because if you see her, you'll know, oh, she didn't have none of that stuff. She just had a breast in the blanket, in a onesie, Like, really. And a good pack and play. I researched my pack and play. I liked my pack and play. Yes.
Before I've done that training or, becoming a doula, what are ways that we can, help in this arena?
So you can email me here, sistermidwiferproductions@gmail.com, and tell me you're interested, and I'll invite you over to my home office. But there's also Birthmark Doula Collective. They need volunteers, and just start showing up at stuff. Yeah, that's really what it is. I would say here in New Orleans, it's just like us, me and Birthmark, right, doing most of the stuff. Yeah, so just show up and get involved. And like with the Birth Story Project, like as an example, we always need help with that. Like we need help with childcare, because that's another thing that we have to, how can you have an event for mothers and don't have childcare available? But it's hard, because if I'm, what am I doing in the group? Facilitating, thank you. As I'm facilitating the group, I can't also pay attention to the toddlers, the children. So we need volunteers to come and like play with the babies on the side, or maybe to go pick up the food, or to drop off flyers somewhere. Like, we need even simple stuff like that we need help with often. Yeah, so just call. I would say me, the New Orleans Breastfeeding Center, Birthmark Doula Collective, those are the primary places of people doing social justice type birth work right now in the city. Okay, and if you have any questions about my doula training, I have 2 ladies in the room who I'll put on the spot who have come to my training, and they will tell you all about it. That's Kimberly and Haley, so ask them, because I always feel like it's better for them to tell you than for me to tell you, because of course, I'm, tell you, but they can tell you also about it. Yeah, so thank y'all. Yes, thank you.